urine till Nakuru.
Yes.
Yeah, so it's an expected pee break. So urinary incontinence is the inability to voluntarily hold in your urine. Yeah. So it happens, and that's the sad part. It actually happens a lot in Kenya, especially in the elderly ladies.
Okay.
I'd like you to, again, to think about your grandma, your aunt. Back in the village, she used to go to church, she used to go to the market, but all of a sudden, she doesn't want to go. The reason being, whenever she does, she gets into public transport, she's smelling of urine. And why is that? She's leaking the urine. So really, we are here just so that we can be able to demystify and make people understand what exactly urinary incontinence is.
Yes.
So first and foremost, I've given, well, women are known to be able to hold pee the most. Well, men can go anywhere in the bush, yeah? But for women, we tend to hold it for longer.
Yes.
And inadvertently also, when we cannot hold it, it becomes a problem to us. So first off, it is more common in women, actually twice as common in women than in men.
Quite an irony.
Yeah, yeah.
Yes.
I know, twice as common, that we're the ones who hold our pee the most, but when it comes to urinary incontinence, we're the ones who suffer from it the most. And because right now I'm going to talk about women first before we go to men, it's because, well, when you think about women, especially the women who've given birth, we're always told, practice your Kegels or practice the bouncing on the ball. That's why people go for Lamaze classes.
Yes.
But that's, we practice bouncing on the ball just so that we can be able to strengthen what we call our pelvic floor muscles. And that's because for us to be able to hold our urine, it is really dependent on that pelvic floor muscle. So again, you have a lady who's given birth to a child. For the first 3 days, if she's laughing, if she's crying, she's not able to hold her urine. And I think, again, that's why people are advised to wear maternity pads. But then after that, it should be able to resolve as you strengthen your pelvic floor muscles by doing the Kegel exercise. So again, I'm trying to drive at, it is more common also in women who have been just given birth. Yeah. So even when women come to my clinic, I always have to ask them, do you have children? How many children do you have? Yeah. What was the kilo of your children, your birth weight? You can find someone delivered a 4.5 kilo baby. For sure, the whole anatomy then is altered with, and that could now predispose you to getting urinary incontinence. I'd also like to differentiate urinary incontinence with what you'd suffer when you're having from a UTI. Okay. Whereby when you have a urinary tract infection, it just tells you, your bladder sends communication to the brain, I need to go to the washroom. And then you get there, you've probably spilled a bit. At least that would be a cause of a UTI, a pathological cause. Yeah?
I'm sorry to interject, but you mentioned a category of women who could experience this because of the biological. You know, you just delivered.
Yes.
Most of the times it's been also related, I know you've heard, matters of menopause.
Yes.
Were you gonna go there? Because
but we can talk about it right now.
Okay.
Because again, also towards, remember the auntie, the shosho, the grandmother who cannot go to the shop anymore, it's because of that. As you become older, well, your muscles become weaker, and also you have hormonal imbalances, and that would weaken now your entire pelvic floor system. So for these elderly ladies, they are not able to hold it. And again, that we see in menopause. Actually, studies have shown that it affects women from around 44 to 65 years of age. That's the pathological sort of urine incontinence. Yeah. So menopause is also a risk factor. Childbirth is also a risk factor. Yeah.
But not childbirth cuts across young or elderly.
Yes, yes.
We all, you know, at some point. Okay.
Yeah, yeah. So another reason why you could be having urinary incontinence is if you've had any surgeries. Yeah. Because there is, you could have instrumentation that was done, either gynecological or due to urological complications, and that's why you need the surgery. Trauma.
Oh, is it?
Yes.
Tell us more about that one. And now, when you're talking about trauma, we're still talking about the women, is it?
Yes, still on women. Again, but now I'll go a bit younger.
All right.
Let's say you have a 13-year-old girl. She cannot hold her urine. We have to investigate why exactly she cannot. And therefore, even as we're seeing this patient, we'll also have to deal with issues like whether it was rape, unfortunately. And also in the younger children, or the younger population, we also have to look at their spinal reflexes, their nerve, because again, when you peeing is a very nerve-induced process. Yeah, your bladder.
Yes.
Ideally should be able to hold around 450 ml. Sometimes it can stretch out to 700 ml. Yeah, and it should be able to communicate to the brain that I need to pass urine. Yeah, so initially this communication starts at around 150 ml. Your bladder tells your brain, I need to go. The brain tells it, hold up, let's give it some time. Then the bladder again will communicate to the brain at around 300 ml. I need to go to the washroom. And then if you cannot be able to hold your urine past that 150, maybe get it to 300, that is also a form of urine incontinence.
Okay.
Yeah. So when I'm talking about trauma, you also see it in people who have been in road traffic accidents and they got spinal injuries. We also see it in children who were born with spinal issues like defects. Maybe their back is curved in a wrong way, their spine did not form as it should, and therefore they will have urological issues. Especially if you have trauma to the lower back, and that's where the innervation mostly to the bladder comes from. There you would now be at a higher risk of getting your urine incontinence.
Okay.
Yeah.
There's one aspect, I'm sorry to interject, but a lot of things that are medical and most that we have discussed here have had some sort of genetic or influence. When it comes to urine incontinence, is there any genetical makeup whatsoever that could influence this?
Other than anything that would have caused your nervous system not to develop, nothing much would be in genetics.
So you didn't say my mom went through this, so I'm going through this? No,
actually, but if they did, that just shows that you have a muscular issue which is giving you a really weak muscle, the pelvic floor. Yeah, so if it was in your grandma, in your mom, in you, again, there are so many, it's like a multi-pronged approach to this, because if it is your grandma, if it is your mom, that means they did give birth. So for them, childbirth would be a risk factor, yeah? If it's in your grandma, if it's in your mom, probably they're menopausal. So again, we have hormonal imbalance. And then now it comes to you. So other than that, you'll be able to see other features in these patients that would kind of direct us to that they have a weak muscular system.
You know, the reason why this conversation is very important is I can imagine how many people are silent about their condition right now. Probably they think there's no light at the end of the tunnel, so I'm just gonna get adult diapers, and this is the only resolution or solution they see. We're hoping to look at any other medical things that can be done or that are being done, to manage. Because is it treatable is another question, or do you just manage it? Is it okay to now focus there?
Yeah, we can. So when a patient comes in to the office, we'll have to first look at what is the causative factor. Remember I mentioned... And
sorry, perhaps we look at the woman. The women, is there a specific treatment for women, or how women approach it in men? Because if not, then we'd rather look at the causes for the men first, and then we come in and
just approach it. Well, let's first finish with women, because in men, actually, it's a complication. It's a complication of having enlarged prostate. So again, we would see it in an elderly man. He's 80. His prostate is enlarged. Again, due to patient education, they have never been checked. They don't know it as a problem. And for some people, it's actually normal. You know, like, oh, I'm old, my prostate is big. So then you'd see this man who's not able to hold his urine. And for him, it would come as a leak. He's not even aware. He just notices the stain on his trouser. Yeah, and that's where now we'll have to investigate him and see how big is your prostate. The other thing that we see in men, which could be a risk factor for you having the urine incontinence, is surgery. We do have surgeries even to reduce the prostate size, and urine incontinence can unfortunately be a side effect or an adverse effect of doing the surgery. But that is not a common thing, because we've really evolved even with the technology and the machines that we have. Yeah. So in men, again, that's why it's not as common as in women. Yeah.
So I'm sorry to bring you back to the age for men now. You've talked of an elderly man, 80, and you've been very specific on the enlarged prostate. The younger men, I'm sure they're watching this morning. Could they be at risk, and what are the posing, factors, if there are any, so that we just understand this age group? You probably need to check, because what if they're experiencing that? There's been a question of your child, maybe you're nurturing a young boy, you're a mother, and at a certain age they're still, wetting their bed. People sometimes think, oh, I'm a shida. What are we looking at really medically in that line?
In men, it's mostly in the elderly. If it is in the young, it's because of a pathological thing. If it is in children, it'd be what we call overflow incontinence. Probably they have what we call posterior urethral valves. Again, it can be surgically treated. That's a good thing. If it is in 20 to 35 years old, were you involved in a motorbike incident? Did you fall down a tree and hit your perineum, and therefore you weakened your pelvic floor? However, men are really, really lucky. Yeah, because they have, two stopping mechanisms. Valves, but really we call them sphincters. So in a man, they have one which is right next to the bladder neck, which is right next to the bladder. It's called the bladder neck. Yeah, it tightens. And then lower, they now have the pelvic floor one. Yeah. So for women, we survive on one. We don't have two like men. Yeah, so that's why, exactly. By the time a man gets urine incontinence, we really have to try to investigate which sphincter is damaged. And they do have, hope in getting or being able to be managed easier.
Now that for men it's a bit not as common, a bit complex, especially for the young, I'm looking at a parent who wants to have this check in time. Could I say there are symptoms that could guide you to want to check, so that, we have this checked in time? Because it's not like cancer where I'd say go for screening, or is it?
No, we don't screen.
But I'm looking at, I am a man and I want to ensure that I'm not going to be experiencing something in my 80s that I might have prevented now. Or how do I do this check, like medically, to ensure that that is for men really, that I am okay?
Okay. So I wouldn't say that they're really stopgaps. Again, when it comes to explaining even to my male patients how to do Kegels, it is so problematic. A man does not understand what Kegels is. You will find them tightening the butthole instead of the pelvic floors, which becomes also a problem, So for men, it's nothing stoppable. For women, you can actually try to prevent it. And that's why I mentioned they are encouraged to do Kegels right before childbirth, just to try reduce your risk of getting it, Again, obesity has been shown, but again, mostly in women, to be a cause of urine incontinence. So even for the patients, I usually ask you, what's your BMI? We calculate it with you. How is your diet like? We would approach that. I'd try to ask you, okay, fine, I've given you a month, go. Let's say you are 95 kilos, try to come back when you're 90 kilos, and then we see how it will. Because, obesity is a risk factor for urine incontinence. So in both men and women, we'd have to address that.
So for men, really, still the check, eat right.
Yes, eat right. Exercise is really good. Another thing that I would mention, when you're lifting weights, you have to be careful.
They love to lift weights.
Yes.
They love to lift weights. Yes.
They need to do it well, just have an instructor tell you, don't go to the gym and lift 180 kilos on the first day. You're definitely going to damage something. It could be the spine, it could be in the pelvic region. So let's not exercise too crazy, let's not lift too much weight.
I'm going to be looking at some of the things we induce in our bodies as well. I don't know, but there are supplements, etc., chemicals. And sometimes we ignorantly do that. But before I take a short breather, I came across some, research, and it showed, of course, it's an international one, but it says previous studies reported high urinary incontinence burden in the United States. If you could bring us statistics in Kenya when we come back after the short break, it would be great. However, the current prevalence and recent trends in urinary incontinence and subtypes among women has not, they said had not been then described but now we are seeing a lot of progress. This is a very old research. I was trying to bring you up to speed on why this is now becoming something we can talk about. And of course, we're seeing, in addition, correlates of urinary incontinence among women had not been systematically evaluated in the contemporary population. If you get it being talked about on a Kenyan television, you do realize that you need this kind of information. Dr. and I will take a very short breather. When we come back, please send in as many questions as you can. Are you suspecting anything? Do you need help? How do you manage? Because that's where we're coming to now when we come back, especially for the women. You have to give birth. We cannot say don't give birth because you might then experience this. And when you get to your 40s, we cannot say, well, you know, get out of the surface of the earth. We have to find a way to live with it. But the question is how. Right after the break, you're watching Healthy Inside Out.
Welcome to Look Up Guest House, Retreat and Prayer Center. When you first come in, we will be happy to receive you at our reception, then proceed to our cozy and well-equipped accommodation facilities. We aim to provide our guests with a unique, comfortable, and worthwhile experience. Here at Look Up Guest House, we provide our guests with a continuous supply of room amenities. A cool environment for all your retreat activities.
Look Up Guest House, Retreat and Prayer Center. For reservation, contact us on info@lookupguesthouse.org or call us on 0746 788 707.
Yeah.
Are you looking to turn your passion to purpose? Vera Beauty and Fashion College now brings you online classes at the comfort of your home. We are a TVET-approved institution with over 20 years experience in training competency-based courses in fashion design and creative arts, cosmetology, hairdressing, beauty therapy, interior design in soft furnishings, event decoration and flower arrangement, hospitality and catering, and training of trainers. To enroll, call us today on 0704 577 577 or visit our website at www.verabeautycollege.com. Vera Beauty and Fashion College, a center of excellence.
Help me identify a beautiful womb. I never came across one till I got to Vera.
Pastors, seminary students, and congregation members who are attending Shincheonji online seminar, Testimony on the Revelation of the Old and New Testaments by Chapter, it is nice to meet you. My name is Tan Youngjin, and I'll be your host today.
Many thanks for keeping it right here for your breakfast dose. And of course, this is the Healthy Inside Out, talking about urinary incontinence. It might be new to you, but very important that you understand the medical perspective behind it. Perhaps not very new to you. You might have seen it, but just did not realize that there was a solution to it. All right, now joining me, thank you very much for staying with us, Dr. You were very instrumental.
Thank you.
We have laid, the foundation. We've, defined it, explained the symptoms, the signs, what could have caused it. But now we are looking for hope. There is always hope, especially from you, Dr. Aris, but how then do we manage it? Do we treat it? Is there medication? What next after I figure out that I have this particular condition?
Yeah.
Yes.
So let's start with one. If you do suffer from involuntary loss of urine, again, incontinence, when you cannot hold your urine for a long time, it is wise to seek care. And when you seek care, what I get most times is that, well, because of the volumes that are seen in the medical facilities around town or around the country, they would solely just link it to a UTI. Yeah. So you go to hospital, you get checked, probably a urine analysis is done or a urinary microscopy culture is done. It shows that you have a UTI that is treated. But again, you feel better for that, well, the 3 days that you're on medication, after which the incontinence comes back. The reason being, we have treated the cause, which is a UTI, but we've not really looked at why. Again, imagine if you're 60, 70 years old, you're back in the village, you have to rush to the farm. The hygiene also is not usually the best.
Okay.
And you're in the farm, where do you have to pee? Do you go back to the homestead just to be able to pass urine, or do you go to the bush? How exactly are you wiping yourself? And therefore, they could also be predisposed to getting a UTI. So when that is done with, they need to still be able to come back and say, you know, even without the urinary tract infection, I still was not able to hold my urine. I still was dependent on putting on pads or lining.
Yes.
And when it comes to pads and lining, it's a major global challenge, especially in the third world countries, because pads are not affordable.
Oh, yes.
Right now, even on the, well, I'd say the cheapest, we have maybe Always, which is retailing at 160. That is not something, especially in these tough economic times, people.
And it's getting worse.
Yes.
Yes.
That someone can really be able to purchase it on a monthly to wear it on a daily.
On a daily, yes.
Yeah. So then what is happening? They leak on themselves and they withdraw because they're no longer participating in social functions, and then that really just affects someone's psyche. Yeah. So then we have a patient who comes, probably is depressed, probably has urinary incontinence.
Yes.
They get seen by me. We take a good history.
All right.
Again, we also physically examine you. You could also be having a tumor. Yes, you could be having a bladder tumor. You could be having a urethral tumor. Urethra is a pathway between the bladder and the outside, yeah? So you could be having a tumor there. You could also be having cervical cancer. Yeah, anything that affects that pelvic floor could be causing you to have urine incontinence. Yeah, even in men, it could be prostate cancer that you're having, and therefore it's obstructing your urethra. Yeah, it could also be, and this is a case that I saw recently, of a spinal issue that you're having.
Yes.
Yeah, that you, okay, it's something that we don't think about, but all of a sudden you're not working. It could be a virus that has affected your neural system. Yeah, it could be a bacteria, well, meningitis and everything.
Well, when you're saying all this, I'm just seeing the need to actually go see a professional.
Yeah.
From where you're seated right now, the way you're saying it could be, you cannot tell that from back at home.
Yes.
All right.
It cannot be something that I have a phone consult with. It cannot be something that you go to your local pharmacy and tell that pharmacist, this is my problem, can you give me over-the-counter medication? It's something that we actually come, we see you. There's a famous Instagram I was actually watching, and she said, does your physician do an exam of you down there? Yeah. When you don't, you're missing out. We are, again, a really well withdrawn, or we keep to ourselves as a society, as Kenyans. So again, it isn't easy for someone to just come up. Yes, but I would like to tell all your viewers, kindly just visit the best healthcare facility. Where we are with our MDGs, even as a country, we are trying to, well, health is devolved, and therefore, even as urologists, we are in a county near you. Even if it's not a urologist, if you're female, you can still see a gynecologist who'll be able to address that. Oh, look at her,
I was gonna go there because you were saying you can see a urologist. True fact is there's only, what, 9 of you, 3 female?
Well, we are 3 females. We are around 50, spread all over the country.
But 3 females?
Yes.
So I'm looking at Mama Mboga or whoever it is that is not very comfortable seeing a male urologist. You're saying okay, I'm going to come to that, but 3 of you, and thank God you're here.
And unfortunately, we are all in Nairobi. However, I do practice in Kiambu, which is the closest I get to the people.
Brings me to the question, because you're speaking to my viewers, and that makes it our viewers, on how far this, sensitization and awareness and campaigns and service would go to them to mashinani.
Yeah.
Because most of the times I'm looking at an African culture full of stigmatization because of lack of knowledge and understanding. Daktari, just create the picture. I know we're giving them solutions, but how do we get this information there? Because you're all based in Nairobi.
Yeah.
Most of you, that is.
Well, the good thing is that we do have outreach programs annually, even as a society, which is the Kenya Association of Urology Surgeons. We have been to Kitui as a county. We've been to Kwale, we've been to Kilifi County because we're in Malindi. We have been to Kisumu County. We have been to Meru County. I think next year we're probably going to Western, maybe Kakamega, So whenever we go there, we do run the sensitization campaigns from around September, and we tell you, do you have this problem? Please do come. Oh yeah, most recently we did Nyandarua and Nyahururu. So again, you can imagine we had a lot of the female patients who then came, who we were able to see and assess, And even then, now we left them in the able hands of the urologists who were there. Yeah, because we do have urologists in Nyandarua. We do have urologists in Malindi. They're male, but they are there.
Yes.
In Nairobi, all females, all 3 of us are here. We try. We really do try, but it would be wise also, whenever you can, if you go to the village, if your mom needs to come see a doctor, just book out maybe a week. Let her see everyone. Let us see a cardiologist who's a specialist in heart matters. Let us see a nephrologist who is a specialist when it comes to kidney issues, in terms of whether you need dialysis or whether you need a transplant. Then let us see her. Let us also see a gynecologist. The good thing when it comes to gynecology is that for a long time we've been able to be doing tests, which also the clinical officers, the nurses have been trained on how to screen for cervical cancer. But what happens when that patient is lost up to follow-up or not properly explained to that they could be having this issue? Again, in Mashinani, we have huge numbers. The amount of time that your practitioner will take with you is definitely going to be really short, and you might not be able to explain your problems. Again, look at also what is considered the norm. I've told you, a lot of elderly women think it's normal to pee urine. A lot of elderly men think it's okay to not be able to hold your urine, and yet it could be something that could be taken care of. So when it comes to management, as we were saying, you come, you get seen, we find the root cause. If it's actually treatable, if it's the prostate, we do a prostatectomy, which is removal of the prostate. If it's a tumor, we also address a tumor according to guidelines. If it is a weak pelvic floor, I'll first ask you, what do you consume? Write for me what is called a bladder diary. A bladder diary is, I woke up at 6, I drank 200 ml of porridge, I drank a cup of tea at 10 o'clock, I drank coffee. Coffee is not good. Coffee is really not good. It weakens so many things in our body. I know it makes you happy. There's always this joke of, oh no, I didn't take coffee.
Do you know how many people are addicted to coffee? If I would not say love coffee, but are addicted to coffee.
But the side effects, I will ask you, how many cups of coffee do you take? Caffeine, really, the component, it could be in many things. Even too much chocolate is not good. Everything is just going to be in moderation.
Do you think we need another discussion on that? But if you can break down what it does to you, they would understand better, especially on the coffee and caffeine and chocolate, things that people pretty much eat every single day.
Well, it just really weakens your muscle and your musculature. So smoking is also not good. It weakens your muscles and has really disastrous effects and detrimental to your health. So then I would be able to ask you, how many cups do you take? What time do you take it? again, there's something like how much urine are you actually passing? You could be taking 200 ml of urine, but passing 1 liter of urine. What is that saying about you?
Is it a little bit more?
Yes. What is that saying about you? Yeah. Or when it comes to urine incontinence, even when we do an ultrasound or a scan, we see a lot of urine is still left in the bladder. That means the form of urine incontinence you have is actually overflow. Like you have so much and your bladder is just tired of holding all that volume, and it's like, I give up. You take that.
Dr. I like that you brought out, that comparison. Most of the times when you go to a science class, you talk about the colon. It's probably failing. Have you had stuff like that? Or probably it's your kidney. Yeah. People really do not know. Is there then relationship between the, the lack of absorption of the water and probably sometimes a kidney failure? Is it anything to do with those sometimes?
For urine incontinence, you could be producing too much urine, what we call polyuria. All right. So again, is that stress incontinence, the types of incontinence, which I didn't want to complicate issues for your viewers, but really there's stress incontinence, there's overflow, there's a mixed picture where you have both stress and where you have overflow incontinence. Yeah, but that's why it's really good to just not think about it as normal, but to seek healthcare, to seek management, to seek proper medical review for you.
And of course, I'm going to take a very short breather again. But right here on Facebook, I want to appreciate Dorcas Tamara saying awesome conversation. And JP, the people who are following earlier on as well. What are your thoughts, guys, on the urinary incontinence? Do you have any question? I'm still giving you guys time. If you're shying away, you can keep your name anonymous, but you need to get the help. We'll come back still with maybe a little bit of those 3 categories, if she may, for your sake, and of course her closing remarks on and what then you would do back at home after you see the the medical practitioners. What are we seeing being done in the hospital, and your take home when you go home? How can you manage the condition? We'll be right back.
Yippee! Kamata floating at 349K. Oh yes, for only 349,000 Kenyan shillings, you become a plot owner at the Great Oasis Gardens, Nanyuki. The Great Oasis Gardens, Nanyuki is located along the Nanyuki-Rumuruti Road, only 11 minutes from the Cedar Mall and right opposite Mount Kenya Wildlife Estate. This is the best place to establish the getaway home that you have always dreamt about. For every 349,000 that you deposit or pay as installment towards any of Optivent's plot of land, you get 10K cash back instantly. Jaza basi twende Nanyuki. Bigger is indeed better.
Pastors, seminary students, and congregation members who are attending Shincheonji online seminar, Testimony on the Revelation of the Old and New Testaments by Chapter, it is nice to meet you. My name is Tan Youngjin, and I'll be your host today.
Kwa habari kutoka kaunti zote nchini Kenya.
Habari zinazoangazia masuala yanayokugusa moja kwa moja ni habari kutoka mashinani. Tunakujuza kuhusu uchumi.
Hakuna haja ya kupiga kura. Tunapigia viongozi gani? Na sisi tunapata tabu.
Kilimo. Afya.
Sisi kama wahudumu wa afya, ikifika saa 6 usiku hatutakuwa kazini.
Uzalishaji na siasa katika kuelimisha na kutoa hamasa ya kipekee.
Tunataka uchumi wa Kenya usaidie mkubwa kwa wadogo.
Ungana nami Lame Kaungo ninapoleta taarifa hizi hapa Look Up TV.
Welcome back. This is The Morning Drift. Of course, keep talking to us using the hashtag The Morning Drift on Twitter and on Facebook. And before we wrap up, I'd love to hear again from Dr. Welcome back on set. About maintaining, you know, or managing, pardon me, not really maintaining, but managing this condition, especially for the women, and looking at the elderly and the young, and also for the men. Perhaps now to bring them closer on what we say, there is hope. How do you go about it?
So management, first, cut out your coffee, reduce your alcohol or cut it out completely. Stop smoking, yeah, that is in your food dairy. Again, also look at how much volume of water you're taking. Take small, but make sure that you're always going to the washroom, yeah? And then also, well, as a preventive measure, you can also wear a pad. It's expensive, but, well, that is just a way for us to be able to contain the urine. We want you to still live a very healthy social life. Go about your duties, yeah? Look at your weight. If your BMI is off the charts over 25, kindly try to reduce it. There are different things that we can do. We can exercise. Again, we can also do Kegels. Kegels, highly encouraged. They're actually things, especially for women, that help us to be able to perform the Kegels. Do the rollerball technique. For the viewers who can, get onto social media, just Google how to do Kegels or pelvic floor muscle exercises. Yeah. The other thing that we can do is management. There is medication. Yeah.
Oh, yes?
Yes, there is. If it is overflow incontinence, well, we try to make sure that your bladder neck is a bit loose, so that you can be able to pass the urine without it overflowing. If it is stress incontinence, there's still medication to help you tighten your bladder neck. Yeah. If it was traumatic due to urethral damage, yeah, let's say, there's medication, but also we can be able to do surgeries that channel your urine out in a way that it is you who is able to control when. Yes, it's your voluntary. Yeah, you know, everyone just wants to live a comfortable. Yeah. We also have reconstructive urology, where we have things called the pelvic sling surgery. We put a synthetic sling on your pelvic floor just to try to be able to strengthen it and hold the urethra in its normal anatomical way.
I'm sorry to, you know, stop you right there. A lot of Kenyans, including myself, have this skeptical way of thinking of side effects.
Yes.
If you go into the surgery, you said surgery could also cause, you know, urinary incontinence. So how sure am I it's not going to make it worse when I opt for surgery, even before I talk of the cost?
Let's say the first side effect that she's going to have, it's your pocket. Reconstructive urology is quite expensive, and that is because it's also quite detailed. It needs really meticulous hands to be able to do it. It's not always 100%, and that's the one thing that patients also need. I tell my patient, it's a journey. Me treating your urine incontinence, it's a journey. We do this one thing, it works, good for us. If it doesn't work, we go to the next. You know, it's like a stepwise ladder approach to how we manage you. By the time we are getting to surgery, it's because we have actually exhausted all the other options, the medical management, the psychotherapy. There's also what we call neuromodulation. Believe it or not, we shock your sacral nerves. We shock your nerves, especially for the people who have nerve injuries. We try to shock them just so that they can start working and you can be able to regain your continence. So there are options, there are treatments for urine incontinence, and it would be good if the patients, the viewers would just step out and ask.
You know, one of the reasons why I'm saying this is very important is because you have actually reiterated and echoed over and over. We want you to live a normal, comfortable life, and for that matter, social life. So guys, if you have any other questions before I wrap up this conversation, just shoot them. But Dr. Ariel's coming into, when you're giving me this treatment, you know, for example, the surgery or, you know, 1, 2, 3, are there any other, are there factors you check, you know, on specific, you know, patients? It could be unique in some sort of way. Is there a checklist? Is there something you opt for because I am like this? Or is it pretty much anyone can do whichever treatment?
No, it's not a blanket. treatment for everyone.
Yeah, I'm assuming not.
Yeah, it's not a blanket treatment for everyone. But one thing I really like to specify is if a doctor, we shouldn't all rush to surgeries. I shouldn't be able to see you today and schedule a surgery for next week. Well, unless it's a prostatectomy, really. But what it is that we should be able to initiate lifestyle changes fast. Yeah, especially in countries like UK, the European countries, yeah, they make sure that if you smoke, you stop smoking before your surgery.
And how practical is that?
Yeah, if you take your alcohol, they give you time. They're like, we've given you 3 months, go home, stop your smoking, stop taking alcohol. And that's why they probably get really good outcomes.
Okay.
Yeah, from these surgeries. The worst part is, even in, in Kenyatta where I practiced and in Thika where I still practice, is that you get a patient, you've operated on them today, that evening they're smoking. It's going to affect everything, their wound healing, and therefore your surgical outcomes are going to be terrible. So let's first initiate lifestyle changes before we run to the medication, before now we finally end up or opt for surgeries.
You know, I want to get clarity on, you know, the way you have stages, cancer stages. I'm curious about this particular condition. If I'm going to wait 3 months to quit smoking and alcohol, does it then mean it never gets worse by the day? What are we looking at? Because I feel like it is urgent that I have this surgery. When you tell me to take time out, you know, of the schedule, are you posing more risks?
Like if it's going to become more severe or worse? No.
Yes. No?
No.
Okay.
No. Yeah, unless, again, as I've told you, unless it's a prostate. That is pretty straightforward. Your prostate is enlarged, you have overflow incontinence. Well, we try to remove the prostate, yeah, or we start medication if you're open to it, but medication will take longer.
All right.
Yeah.
So either way, it doesn't get worse, doesn't get better, but you still need to access some medical care and attention as soon as you possibly can.
Please.
Hygiene.
Yes.
For somebody who's still trying to put themselves together, trying to also talk themselves into coming, to check, you know, on the medical attention and, you know, guidance, what can they do in the next 2-3 days to ensure that we don't have any UTIs? You know, there's a hygiene. There's just, I know it comes out basic, but sometimes it's important. The same way we talk about oral health and brush your teeth in the morning and in the evening. There's certain things people overlook. They do not know how important it is not to. What would you, pick as the first, top 5 on the list? Okay.
So what I'd advise people is if you can, just make sure that you change your inner lining or your inner wear twice a day. You can shower if it's in the evening, because again, that's after work, and if you're looking at someone who has constrained resources, when they shower, they at least make sure that they change their inner wear. If you can afford, you can buy the manufactured pads. If not, there are newer ways of, creating a lining. They take, pieces of cloth and fold them, and that's what you will use, When it comes to ladies, again, always encourage them on how to wipe. They should wipe from front going back, and also, time yourself, 2 hours, go to the toilet, increase it to 3 hours, increase it to 4 hours, and just see how long you can stretch your timing.
I like when you give the timings, and at least just keep it in check. But of course, Dr. we can always reach you. Social media platforms, because somebody's asking, I don't want to talk about it right now, but I'd love her to assess, because you say this is not something you can talk over the phone about.
Yes.
So how do we get you where you stationed? I heard you talk about Thika and also Kenyatta. I mean, lucky us, you're in a public hospital. But how do we reach you? Do we DM you? How do we find you? Want to be in touch?
Okay. Yes. So when it comes to social media, which I have really not been able to grasp too well, I do have an Instagram page. It's called the Urology Clinic. There's actually my contact once you go there, for those who are tech savvy. When it comes to also finding me physically, my private office is at 40 Suits on the 8th floor. 40 Suits is right next to Kenyatta National Hospital. And then I also run a clinic, and I'm the resident urologist at Thika Level 5 Hospital, which is in Kiambu County.
So guys, of course, that was just to have you, in touch with Daktari. It could be your mom back at home, and we have said this information, you need to run with it. And stigmatization, psychologically, I want to bring that aspect. You have said they're affected psychologically, so the mental health check. That means then you work closely with psychologists.
Yes.
How do you know the patient has really gotten to that stage?
That is what will bring them to hospital.
Oh, yes.
Yes, most time you get children to relatives and they're like, he's so withdrawn, or mom is no longer what she used to. Look out for these symptoms, as in these signs, really. She used to go for women's guild or church functions every Tuesday, fellowship, every Saturday choir, every Sunday church. And then all of a sudden, she's no longer doing that. You have to ask her why. It's something that she would passionately go to. What has happened? Is it the stigma of her always smelling like urine? Is that the problem? If someone used to go to, let's say, like the major or a town nearby to do her shopping, the town center, they're no longer doing that. Why is that? Is it that they do not want to be in a matatu before they get to where they're going? And even when they get to where we're going, we don't quite have a lot of public toilets. So these are just the telltale signs, and then you'd be able to see mom needs something, or shosho needs something, or auntie is trying to tell us something, yeah? If it's your dad, he's no longer hanging out with his peers, yeah? He's just seated. It can be quite embarrassing, yeah, to just pass urine on yourself, and your child or your caretaker is the one who's seeing it. So then just be able to pick these subtle signs and then just take them to hospital. You'd be amazed how they open up to us. Yeah, once we kick you guys out, well, the elderly do open up to us.
Amazing. I like to hear that. It's a positive note. And of course, just to bring into, this conversation, that we lack proper data. As we're speaking right now, as far as the government is concerned, because this is a national issue. I wouldn't lock it out on, national issues. And Daktari, I just want you to, probably as your closing remark and as your parting shot also comes with, what then you'd say about having this data really put in place, research and, bringing more urologists on board as well.
We probably should be able to research more about it and have proper data in Kenya. There's some paucity on that, but we should be able to address it. But what we know, again, is that it's more common in women.
Yes.
More women who have given birth. More in women who are between the ages of 45 to around 60 years old.
Right.
Yeah, again, that's the same time menopause is happening. So when it comes to us comparing to American data or European data, we are almost at par. It's just that for us, for a really long time, it was taboo to speak about it, but now we are sensitizing people and we should be able to get proper feedback.
I'm actually glad that you said it was a taboo, that was then, but things are changing. Please change with us for the better of our loving mothers, aunties, sisters, brothers, dads, and, family and friends. Thank you so much, Daktari, for creating time. Do come again. We need more light on these things.
Sure.
That's it for the Health Inside Out. You want to get more of this on the YouTube channel, Look Up TV. And also do not forget to leave us your comments below. If you want to be in touch with Daktari or any other health practitioners, it's always on the Health Inside Out. Is there a challenge you're facing? Let us know if it is something we can have the experts on set to talk about. We will not shy away because it is our responsibility that you are a healthy nation. We'll be back with Simba with the summary of today shortly after this breather.